Good morning. My name is Jess Johnson, and I'm a nurse here at the clinic. I'm sure you know about the surgery you're about to undergo, uh, and I'm here to give you a brief information about the surgery. If you have any questions or concerns, please stop me and feel free to ask, and I'll be more than happy to answer them. Uh, I'll start by giving you a rundown of the surgery. The surgery you're about to undergo is called a Mohs surgery. It's also known as Mohs micrographic surgery. The purpose of the surgery is to treat and remove skin cancer. In your case, Mohs surgery will be the most effective for treating and removing basal cell carcinomas located on your cheeks. BCCs are abnormal growth or lesions that arise in the skin's basal cells, which line the deepest layer of epidermis. BCC is one of the most common form of all cancers, and it is caused by long exposure to the sun over a period of time, and it could look like pink growths, red patches, scars, and open sores. BCC almost never spread beyond the original tumor site, but it should be taken very seriously. Uh, the procedure for the surgery is done in stages, but all in one visit. You don't have to come back for the surgery itself later on. The dermatologist who will be performing the surgery is Dr. Thomas Matthew. In this process, first, he will examine your biopsy and determine how you should be set up for the optimal access during surgery. Um, After injecting a local anesthetic to numb the affected area of the cheek, a thin layer of tissue will be removed using a scalpel. This tissue is taken into the lab for further analysis. The wound will be temporarily bandaged until the analysis of the tissue is done. The tissue sample is cut up, prepped, and examined under the microscope slide, and any cancer cells present are marked. Um, Once the analysis is done, you'll be informed whether you need another layer of tissue removed or not. If more cancer cells remain, another layer of tissue will be removed from that precise location while sparing the healthy tissues. This procedure is repeated until no cancer cells remain. Depending on its size and location of the wound, he may stitch it or leave it open to heal by itself, or even refer to another specialist to help close the wounds. The surgery can take several hours depending on the rounds of tissues removed. It could also be affected by the time taken to prep the microscope slides. But before you go into the surgery, I should warn you that local anesthesia injection might be the most painful part of the experience. I know this is not something you're looking forward to hearing, but there's also a possible chance of scarring depending on the location and the size of the wound. This should not be something that scares you away from the procedure because it has the highest cure rate and saves the maximum amount of healthy tissue. Um, but for optimal healing, make sure you follow Dr. Matthews' instructions for scar and wound care. Make sure to avoid cosmetic products until the wound is completely cured. Now that given you a brief explanation of the surgical process, if you don't have any questions, I can go ahead and schedule a follow up for you to come in to remove your stitches. The optimal time for you to come in to remove the stitches on your cheeks will be between 7 to 10 days. In the next 7 to 10 days, when do you like to schedule your appointment for the removal? And with that being said, I think it is time for your surgery. I hope everything goes well and we get to hear back from you soon. Thank you. Have a nice day.